Most people stretch to try to get rid of sciatica, but they're typically overstretching. That nerve's already irritated and they're causing it to get worse. So we want to be very specific on what exercises we do, what stretches we do, and don't miss our video on exercises, the positive exercise that you should be doing for sciatica. If you're getting that information on what not to do, what stretches not to do, what exercise you should be doing, you'll start feeling better a whole lot faster. We have a couple different models right here. We want to be thinking about where the sciatic nerve is. So it's this flat nerve coming out to the side. So same thing right here. I'm coming through this sciatic notch. We have a lot of stuff going on the front. We have the psoas. It's our major hip flexor. It really looks like a fist inside the body. It's really thick. And so our psoas major and our iliacus, they make up the iliopsoas. So if our hip flexors are tight, then we're going to be pulling our back into extension. That's going to close down. When our back goes into extension like this, it's going to close down that space for those nerves where they're bifurcating, where they're coming out, and they're going through this gluteal notch right here, and it's coming out to the side, and then it goes down the glute right here. So now if I'm looking on my body, it's going to come out right here and come down. I don't want to put pressure directly on that nerve, but I want to put it in areas like if I'm tight in these muscles right here, then they're pulling around and putting pressure on that nerve. So we're going to talk about how to address that. We want to take that tension out of those muscles and get that stretch off the sciatic nerve. But then we also have to think about where does it go when it comes down the leg. So it's going to come right in between the hamstrings right here, and then it's going to bifurcate and split off into the lower leg, going in both directions. So knowing where your sciatic nerve is really important when we're doing stretches, when we're doing soft tissue work, even when we're doing exercises. We've got to know that anatomy. You're walking around in this body for the rest of your life. So let's protect it and make sure that it stays protected long term. Another model that we should be looking at is right here with our skeleton bob right here. So our glutes are attached right here and they wrap around and grab this femur. And so they pull it out to the side. So when I'm engaging my glutes, my knee tilts out to the side like this, driving over. Now, I want to address that. I want to be using my glutes. So what we think about is that I want to load through my glutes and through my hips. So I keep my Superwoman emblem stacked over my belt buckle. That also allows my diaphragm to fire. So our abdomen is like a barrel. We're going to define the core as our abdomen, our hips, and our shoulder blades. And so how they work together, how the core of our body works together is really important. And to get long-term solutions, we need to be activating our glutes, and about 80% through the glutes and 20% through the abdomen, or 10 and 10 up here. But 80%, our power is coming through our hips. So if we're not firing our glutes, we're not going to get a long-term solution. So with these stretches that we're doing to help with sciatica, it's a positive. We're going to be feeling a lot better. But for long-term solutions to get rid of it and keep it gone, we've got to address our glutes. We got to fire them up and we have to use them consistently. Stretch number one, we're going to do a glute stretch. So we're going to do a cross body glute stretch. We're pulling up to the opposite shoulder. So here in standing, I can get my leg right here and I can pull up to the side, but that's not the most efficient way to do it. What I want to do is actually lay down on a table, on the bed, on the ground, and I'm going to put my leg up here on the other leg right here, and then I'm going to grab my lower leg and I'm going to grab my knee and I'm pulling up to my opposite shoulder right here. And I'll show you exactly what it looks like when you do too much. There is such thing as doing too much of a good thing. If I'm pulling up like this, now I'm pulling through my low back. That's not going to be positive for me. So I want my butt, my upper butt and my pelvis to stay down on the table, the bed, whatever you're on. I want it to stay down while I'm pulling over. So now I'm feeling that stretch just through the hips. I'm pulling, that sciatic nerve is going through there, but I'm not actually pulling on the nerve. If you feel irritation in the nerve zinging down and you're not feeling this stretch in your glutes, then it's too early to be doing it. So we really want to focus on lengthening the glutes right here. And our glutes, most of the glute muscles do external rotation. And external rotation at the hip is our hip going out. So our foot's coming inward in external rotation. So doing a stretch this way, I can even do it in sitting if coming up like this. What I don't want to do in sitting, if I'm sitting down and I do this, Now I'm folded up in my back and I'm pulling through my back. These are negative things that we don't want to do with our sciatic nerve. We don't want to put length through our sciatic nerve because it's coming through our entire trunk and chain is bending forward instead of staying in a neutral position and pulling up and over to the opposite shoulder. When I do this, I'm in a good position. So we want to pay attention to what the angle of our lumbar spine is while we're doing these stretches, and that's going to give us better results. And when we're doing it consistently, we're going to get results very quickly. Number 2 is a hamstring stretch. Most people are going to do a hamstring stretch the traditional way, where they bend over and do this. So if I'm doing this, then I'm doing it again. I'm folding through my low back. And I want to protect my low back while I'm doing this stuff. Our first pinch point is in the lumbar spine, and then it goes down in the glutes. We have a second pinch point, and then it bifurcates in the hamstring, goes down to the lower leg. So we got about 5 different pinch points. So the first one we can address and we can pay attention to. So I don't want to fold in my back. So if I can shift my hips back as I'm coming down, I don't have to go down very far, and I can feel a hamstring stretch right here, and I'm putting my weight on my heels. Now, I wouldn't start out in standing. I would actually start in a seated position, and I can do a single leg right here. So now, I also don't want to fold forward, so I don't want to put all that pressure on my lumbar spine again. What I'm going to do is I'm going to keep myself in a neutral position, and I'm shifting here at my hips. So I'm coming down right here, maintaining that position, keeping my chin in a neutral position, and I can feel a crazy stretch right here. If you're flexible enough to get to your foot, go ahead and grab it. You can pull it back, and that's going to pull on your calf as well, which is something we're going to get to in one of the next stretches. We want to get our calf, our hamstring, and our glutes all moving in a positive direction, and we want that nerve gliding around through that muscle tissue and loosening it up. Stretch number 3 is actually lengthening through the calves. When we talk about the calves, we have 2 different muscles. One of our muscles crosses the knee. So the gastroc, it's the heart muscle right here. It crosses the knee and comes up and attaches to the femur. And our soleus is the bigger muscle right there. And you see it in people who ride bikes, like bikers, is like riding on the side of the road. They have really big soleus because their knees bent all the time. So they're activating that soleus muscle. Their calves are really big and defined, right? So we want to address both of them because our sciatic nerve has split off in those areas and it can get stuck in each one of the muscles. When a nerve gets tapped and gets irritated, that muscle tissue starts to cinch up around it. We have a system of getting nerves to glide around. We want to break up the muscle tissue, loosen it up. We want to increase blood flow. That's number 2. And then the third is we want to lengthen that tissue. And if we do that consistently, we're going to get tissue change. Low load, long duration is always best for stretching. So historically, with all the research, it says that low load, long duration. So not a super intense stretch, but just a gentle stretch, but we're holding it for longer periods of time, at least 30 seconds up to a minute, and doing multiple sets. So 2 to 3 sets. We do that consistently, we're going to get tissue change over time. Don't expect it to happen. You expect to get results quickly and to feel better, but don't expect to have the long hamstrings within 2 or 3 days. We need to be consistent with this over 3 or 4 weeks. You'll see some really good results with that. This stretch is stretching through our calf, and so we're going to address both of them. When we do the calf stretch, we're going to come out to the side. I'm going to be leaning against the bed, the countertop, something so I can keep my back in a neutral position. The consensus of all of these stretches is that we're keeping our back in a neutral position and we're making movement happen through our glutes, through our hamstrings, through our calves, through the joints in our hips, the joints around our knee, and the joint around our foot and ankle. So we're getting to all of those nerves where they're going through muscles, but we're not twisting up and twerking on our lower back. And hopefully you're not twerking very often, because that could be kind of funny. But what we're going to do is get right here. So I'm shifting my weight down on my heel. My knee stays straight, and I'm pulling on that gastroc muscle. So I should feel a stretch in the upper part of the calf right here. So I come back, tilting forward, and I'm not doing this. I'm not extending in my low back. That's going to put a lot of tension on my first pinch point, so we're avoiding that. We're going to do a lot of positive and really want to decrease the negative things that we're doing to that nerve. Most of the people that come in here, we've seen them that they've been pulling on that nerve over and over, and that's why we want to address this stuff early. If you can get results really fast, then you're going to get motivated to continue with doing this stuff, and consistency is where we're going to get the long-term improvement. So when I come back, My knee stays straight right here. I maintain this position. My back's in a neutral position. I hold this for 30 seconds. And then all I'm gonna do is shift my weight back just a little bit and bend my knee. And it's just a slight knee bend. Now that stretch has moved down to my lower leg and my ankle into the bottom of my calf. And so I'm getting more of the soleus and I'm getting an ankle mobilization. So I'm loosening that up. So with doing those 3 stretches, we're gonna be able to get a lot of length through that sciatic nerve. We're gonna be able to activate muscles better because those muscles are gonna have more pliability in the fibers. And so we do them consistently. Each one of them should be done. Optimal will be 3 sets for 30 seconds with each one of them and doing both sides. Even if your unaffected side isn't something, if you're pressed for time, don't do the unaffected side. But when we're trying to beat an injury and fix it long term, we're always gonna do bilaterally. A bonus stretch is actually lengthening through our thoracic spine, lengthening through our shoulder blades. So what we're gonna do is I get up against the countertop, I'm gonna come up and under this way. So my palm comes up, I'm gonna drop my left hand onto my right here, and I'm gonna drop my head down onto my arm and just rest it there. And then I'm driving my hips back and my shoulder blade, my rib cage back, just like this. And I'm holding that stretch right here, lengthening through my lat and all these muscles right here. So if this causes any pain in your back, then we don't want to do it, but most likely we're twisting in the back a little bit. So we want to limit that. So I come here, push back, and I shift my hips back. So I'm loading through my glutes and my hamstrings, and I'm redistributing that stress back there, and I'm getting length through my thoracic spine and my lats, where a lot of our clients are tight when they first come in. And I'm going to do both sides. Same thing. Think about doing 30 seconds, or you can also think about just doing 5 to 7 breaths, because a lot of our clients, they'll hold their breath when they're doing a stretch. We don't want to do that. We want to breathe really good and allow our body to adapt. In a previous video, we talked about doing active pigeon. So active pigeon is a stretch and an exercise. So when we do active pigeon, this would be a progression. So we have our initial 3, we have an option for our upper extremities, and then another option for a progression is coming up through here. I'm gonna drop this left leg underneath the right, and then I drive back. And so I keep my back in a neutral position right here, and I'm just stretching through this glute right here. Now, after doing a 30-second stretch, I'm gonna use that glute slowly to bring me back up, and I do 5 reps, activating that muscle. When I'm using that muscle, my spine stays in a neutral position, and then I'll go back into it and I'll hold it for 30 seconds, and I'm gonna get a lot more out of it. It's called PNF stretching, which is a crazy word, proprioceptive neuromuscular facilitation. Not that important. You can just search PNF stretching. We'll have more videos on it. And then we have a blog that on our website where it talks about PNF stretching and the effectiveness of it. So we want to activate a muscle when we're stretching. So right when we get out of the stretch, we activate the muscle, and then we go back into the stretch, and we're able to get a little bit deeper. Make sure you subscribe to the channel. I don't want you to miss any of the videos we're putting out. Hit the bell icon and you'll get notifications. We're gonna be consistently putting out content that's gonna be quality, and our goal is to protect you from bad information. And there's so much information out there from unqualified people. We fix these issues consistently on a weekly basis here in the clinic. So you're getting the quality information that our clients are getting when they come in here, and you can fix most of these things yourself. So hit the subscribe button and hit that bell icon and follow us so you don't miss out. A major focus with this is to isolate these movements. Don't do too much. There is like really pushing the stretch or pulling through the back, like chasing it so much that we're pulling through the back and we're moving in areas that we didn't intend on moving. That's gonna cause us more problems long term. So we really wanna focus on the cues and the things that we talked about, isolating those areas, and don't do extra. With all of these stretches, it's all about limiting irritation, increasing glide of that nerve in the muscle tissue. So we're activating those muscles. Remember, when we break up muscle tissue and then we get blood flow to it and then we lengthen it, it's the most efficient way to get long-term lengthening. Like, subscribe, hit the bell icon. We'll see you in the next video. Get mobile and stay active.